phenomena. Don't know how, time is now, find your fitness formula. Meditation and nutrition, soul power and new vision, pure intention, attitude gives you mission and ambition. Small steps every day is the new phenomena. To know how, time is now, find your fitness formula. To know how, time is now, find your fitness formula.
A very warm welcome to all our viewers once again, and Om Shanti. I welcome you all to a fresh new episode of Fitness Formula. Really, what is the fitness formula? How do we get to that formula, that health, that fitness that we dream of, that we aim at achieving? I think somewhere it is necessary to let go of the negative and focus our attention on the positive. Once again, we have Dr. Girish Patel with us in the studios. Doctor, welcome. Om Shanti.
Shanti.
I think, Doctor, somewhere when negativity or something from the past is holding us, it becomes very hard to move on and achieve whatever our dreams are.
True.
And moreover, I think it is like an addiction, you know. If an addiction is there in your life, an addiction, when I say addiction, I don't mean drugs. It could be any addiction. You know, if the wages of an addiction were paid immediately, probably it would not seem so attractive.
Excellent. Yeah.
What would you like to say about
No,
it?
it's great. No, if you get immediate effect, no, suppose if you smoke a cigarette, no, immediately if you develop acidity, immediately if you develop pain, or no, if you become breathless, then you will never smoke. Negative effect comes later on. That's why no, we do. You know, there is a medicine for alcohol. No, those medicines are given unknowingly. And no, if someone drinks, no, immediately they develop some reaction like redness of eyes, headache, sometimes bit of vomiting also. And then automatically they stop.
Correct.
When patients are not told, addicts are not told that such a medicine is given.
Right.
And there are a large number no, who would give up because they will associate that no, every time I have a sip of alcohol, I am getting this reaction. So alcohol is a culprit. Let me not drink.
Right.
No, of themselves they decide.
Correct. So anything which is holding us from achieving our dreams, from achieving our goals, from getting us to that fitness, actually, what is it? Is it like an addiction? And how do we get rid of this addiction?
It's not everything. Like no, there may be so many things which are no holding you back. As you said, no, not letting go the past.
Yes.
Times can be addiction, no, what we call obsession.
No, because with some people, even going to work becomes an addiction. Working 10 hours a day becomes an addiction. For some people today, the television has become an addiction. You know, they don't, you know, so much of time is going waste
True.
and just watching the television. For some people, the phone has become an addiction. You know, for some people, talking has become an addiction.
Very
So, addiction can also be of many kinds, isn't it?
Yeah. And Sunanaben, we have to find out between good and bad addiction.
Right.
Positive and negative addiction. Like, no, somebody can get addicted to exercising even. But no, I would say that's a good addiction. If it's in a limit. Suppose no, if he's exercising every day for an hour, and if he doesn't exercise, no, he feels uncomfortable and all, then no, let it be. No, it's a good addiction. Person would exercise.
Right. So even there you are saying for some time, you know, if when 1 hour every day is normal, natural, even there it can become a bad.
Yeah, no, bad it can. No, if somebody does exercise for 6 hours a day, no, he would feel good. It is healthy that way. No, health wise there is nothing wrong.
Right.
But no, many of his other duties would be affected.
Correct.
He won't be able to take care of his children, family, work. And then no, that also would be addiction. We'll have to request that person that no, reduce it. Once in a while is okay. Like no, every Sunday you run for 6 hours.
So how to get closer? To get closer to the fitness formula, we need to let go of these addictions.
Yeah, definitely.
How do we do that, doctor?
The very first step, no, is a decision. Most, no, they don't decide. Even smokers, they don't decide. And they have different logic. They might say that, no, I know somebody who used to smoke, say, 20 cigarettes and still he is healthy. I know another person who never smoked, but he developed lung cancer So how do you associate?
Correct.
And then no, they will have such logic. But the whole reason is, like, every smoker doesn't develop lung cancer.
Correct. Because I think everybody's immunity is also different.
And no, every patient who develops lung cancer is not a smoker.
Correct.
There are no even other causes. Genes are possible. Environmental pollution is possible. The big studies are done. Like taking say 50,000 smokers, 50,000 non-smokers. And then they found out that out of 50,000, maybe 2 non-smoker also develop cancer of tongue. But there 200 smokers will develop cancer of tongue.
Correct. So the percentage is obviously
is
much
almost
more.
Then would say it is almost say 10 times more or 100 times more that way.
Right. So how do we let go? You're saying first you need to make a very conscious decision.
First a decision. And that I want to give up completely. It may be that you do it step by step. Slowly you reduce and ultimately stop.
But don't you think if you want to give up something completely, you're running away from it? Like suppose if if I'm addicted to watching TV all day, then if I tell myself, okay, I'm not going to watch any TV, I don't think that's also reasonable.
No, don't completely give up. Like watching TV is addiction. When you don't get TV, you have a problem. Like now Facebook addiction has become so much, or addiction to internet. When parents take away mobile, or if parents take away laptop, then they become hyper.
Yeah.
They become very anxious. Somebody might destroy something. So that's the time when now person has got addicted to it. If you are able to watch, say, a couple of programs and then you are okay doing something else, then it's not addiction.
Right.
And step by step we should do it.
Correct.
Like if somebody is watching for the whole day, he can reduce to say 4 hours, then give a break again for a while, and that we keep reducing, and ultimately come to that minimum thing which is needed.
Whatever you think is reasonable, maybe half an hour or 1 hour.
1 hour, yeah.
Whatever.
Or maybe in this sort of addictions, at least for a while we should give up completely. Maybe for say 15 days.
Okay.
And after you succeeded, then now make a conscious choice that I am going to watch only maybe half an hour twice a day or something.
Some people also fix goals. Like they'll say, okay, let me do this for the next 20 days, 15 days. How does that play an important role?
That can be, it can be your own choice. Like, for smokers, sometimes we say that, think of, an important, some day, maybe your birthday, maybe some important festival.
Right.
Or something else, which is coming within 15-20 days or 1 month.
Yes.
That this day I am going to stop completely. And till then, I will put my best effort of reducing. Not that way, that if I am smoking 20 cigarettes, tomorrow I will make 10. No. Say minimum possible. It's possible that you might be able to do with 4 cigarettes also. No, you don't need even 10.
Correct.
So there what we should do is, once you have decided, give even those affirmations that I know how harmful it is. It's a big barrier in my fitness, in my health. So I must give up. I am mentally prepared, totally determined to give up. So
there is certain amount of introspection also going on.
Introspection, some this sort of affirmations.
Yes.
And then maybe do some meditation also. And whenever urge comes, immediately don't smoke. Even though the best is don't keep any cigarettes in your pocket. Even not at home. Whenever this urge comes, tell yourself that can I not wait for another half an hour? The answer will be okay, it's not very serious. So fine, let me wait for half an hour. After half an hour, again you can say that can I not wait for 10 minutes? Answer may come that yes, you can wait for 10 minutes.
Right.
And meanwhile, there can be something else. Like, you can have a chewing gum. even some other things also,
Correct.
which might have a similar taste, and those things you can avla, those things we can chew and might give you the more or less a similar feeling, and with that keep waiting. When you feel that now it's impossible, it's really very, very serious, I am getting highly irritated.
Yeah.
Even if your work is affected, don't worry. Many tend to smoke thinking that I am not able to concentrate. It's fine. For a week's time, even if you are not able to concentrate, it's okay. Because after a week or 10 days, your concentration will become better.
Right.
Maybe this is a compulsory leave or something of that sort. But when it's impossible, go and buy one cigarette only. Don't send somebody else.
To get a pack of cigarettes.
Yeah. You should go yourself. So that it takes some effort.
Right.
Buy only one cigarette. Only smoke half of it. You don't need full cigarette. The nicotine which is necessary, half may be enough.
So I think the fitness formula, to get closer to the fitness formula, we really need to be in touch with our own conscience.
And then put this effort.
Yeah.
Some say, I don't have a willpower.
Yes.
It's not a question of willpower. It's only a question of convincing yourself a little bit. It's a question of even postponing.
I think you were talking about cigarettes. What about, the other things? Like suppose if somebody is addicted to wasting time. Okay. Now there I think if you were to make a good timetable for yourself and with determination you follow that, then even you're watching TV, you have put it there. Okay, I'm going to watch TV for like half an hour. Then let's respect that timetable, let's stick with it. I think that would solve a lot of problems.
And even little bit push yourself. When we push little bit, our power is tremendous.
And you feel good.
Good, yeah, definitely. And because when emergency comes, we have done.
Yes, we have done.
So why not? I can do it right now also.
Correct. If there's a wedding in a family, we can stay awake the whole night.
Whole night, yeah. So similar, this can be done. Even smoking, I was sharing something that only smoke half the cigarette, as I said, and then don't inhale deeply. Let that gas be only in the mouth and expel. Even that's enough. From the mucosa, nicotine will go in the blood. So
Right.
that way, the harm is less.
Correct.
So every day it might fluctuate. That one day maybe 4 cigarettes, another day 2 only. One day maybe 6 cigarettes also. But keep minimizing.
I think the same would apply to people who are really trying hard to lose weight.
Okay,
Because you're so tempted to eat food which is fattening,
True.
it's really tasty. So I think slowly we need to reduce.
Reduced, yeah. With understanding. The reasons may be different.
Right.
The motivation can be different.
Right.
Like in the smoking, I would say go for long walks, because then endorphins are released.
Correct.
And those endorphins have a more or less same effect. Do yoga, do some relaxation, meditation. And that day, when you have decided, like on my birthday or on an independent day, I am 100% going to give up. Then there is no reason. And don't think that a day before I will smoke 50 cigarettes, because tomorrow I am going to stop. It would never work.
Correct.
Last day also should be minimum.
So you think we should give ourselves monthly goals that would really work? If we have a monthly goal, say somebody wants to lose weight. So if you give yourself a monthly goal that I am definitely going to lose 2 kilos by the end of this month. You think that's better than giving yourself yearly goal? Okay, by the end of this year.
Even we should give weight reduction. If you are thinking, it should be a goal of 10 days. Within 10 days you should lose at least half a kilo.
Okay.
Or maybe 1 kilo minimum.
Right.
And because that is measurable.
Correct.
So that way there but in these actual addictions, like drugs or alcohol and all, it should be minimum.
Should be minimum.
Yeah, like very second day you might be on 2 cigarettes only.
Right.
And then your confidence will increase.
Right.
In last day let it be minimum.
Right.
And whatever happens, you will never going to touch.
And then take it as a challenge.
Yes.
Like you were saying that when a stressful situation comes, take it as a challenge. So I think when you are trying to leave something, you're trying to de-addict yourself. Why not take it as a challenge? And really, once we accept the challenge, it becomes very easy.
Yeah.
And it's done.
Done.
It's done.
You are happy, like
You're very happy.
that. No, I am going to do it.
Yeah.
That sense comes. Other few factors are useful here.
But then, how do we let go?
No,
how do I let go?
No, let me share some other steps in this. That make an announcement. That resolve. Don't keep it only to yourself. Tell many people. Because then you are conscious
Yeah.
that you have told others.
Now you're responsible.
Now if you smoke, others would know.
Correct.
Even I know 2 professors, they themselves decided that now we will stop. And both had stopped. Both felt that we had temptation.
Correct.
But because we had told others, that was a factor.
Right.
That he would know.
So you think making an announcement is a good idea?
Yeah. Even they say give a treat also if you want.
Right.
Another thing, there are always temptations.
Yes, always.
Someone or other
Always.
temptations are there.
Yeah.
So in that, take someone's support. One gentleman who had give up smoking completely, but he knew that when I go for morning walk, and when I pass from that place, from where I used to buy cigarette, it's terribly attracting.
Correct.
So he told his wife that you also come along with me for morning walk. You would benefit as well as when that temptation come, you can stop me.
Right.
So we should decide. Alcoholic Anonymous, if you know, they have a 12 points. And the very first point is, I don't have enough strength to give up, please help me.
Right.
Anybody can help, friends can help, God can help.
I think it is very important when there is a problem, we should first acknowledge that there is a problem. Only then we can, that transformation can begin only then once we acknowledge. A lot of people don't even acknowledge that there is a problem. So when you're saying, I need help, then I think the transformation has already begun.
Yes.
You should congratulate yourself.
Yes.
Yeah.
So this is another important aspect. Then even for addictions, the very important thing is prepare your state of mind. Generally people think only superficially about addiction.
Right.
That he's alcoholic, he's drinking, family members will shout at them, will fight with them and all. We should understand that there is some vacuum within. As a matter of fact, nobody likes
To be an addict.
Yeah, they know. But because there is some vacuum and they don't know how to fill the vacuum, so they got addicted to it. Later on it may be, most of the addicts will tell you that there is no pleasure out of this addiction.
So I think because
It's
now
only-
that you say that there is a vacuum, that's why they are doing it. I think the family members and friends need to be very compassionate to such a person. Whereas
support
they start
them.
blaming,
Blaming,
The family says, oh my God, like he's ruining his life, he's ruining our life. And it's a very bad situation, really.
True. Even they might say that he's doing purposefully.
Yeah, he's doing purposely.
10 times he said, still he is drinking.
Yeah.
But we should realize that still is not able to fill the vacuum. And by fighting, by quarreling, you are adding it.
To that vacuum.
Yeah, it will increase, it won't reduce. Rather, if you support, it will be of great help.
No, and support how?
In different way, suppose if family environment, if person is disturbed, because of quarrels and all, so if you support, it will be good.
Like just lovingly,
Loving,
maybe create a nice
help,
atmosphere.
True, to help, even accept them, even you say that I accept you as you are. Only thing, what we hate is this habit.
It's not about you.
Yeah, it's not about you. As a person, you are good. Only this particular habit is disturbing you as well as us. And if once in a while, if person sleeps, then think that it is a lapse, it's not a relapse. Lapse and relapse are different.
Correct.
One day, suppose, if you smoked a cigarette, but very next day if he stops, then there is nothing. It's only when person continuously smokes, then it is harmful.
But then there are small addictions also, like some people have a bad habit of biting their nails. You know, now that can be very annoying to the others around
True,
that
true.
person. So how do you deal with such
Actually,
things?
no,
Should we
no.
keep telling them off?
No, it's a OCD in a way. Like, no, when they don't do, no, they feel anxious and plucking the hairs even, no.
Yeah.
Sometimes, no, it's a OCD when they know that, no, how harmful it is.
So how do you deal with such a person?
No, there one is realization. Then, no, to introspect and find out that, no, what's the cause.
No,
Yeah,
this you're
what's
talking.
missing.
You're saying this for the patient.
Yeah, I'm talking about patients.
And what
yeah.
about the family? Please tell us, how should the family also react?
No, even no family here, again, no, we should be supportive, treat him, even suggest that even though for all this, there's a good medicine. This is a type of OCD, obsessive compulsive disorder, where there are wonderful medicines.
Really?
Yeah, totally also person can stop.
And for the patient, you were saying, sorry.
Medicines are for patients only mainly.
No, but you were telling us some techniques
Yeah,
that he can...
techniques to, one thing is that awareness, no,
Yes.
insight that what's the cause.
Correct.
And no, once he has found the cause that no, maybe I am missing this. Here again vacuum or something.
Yeah, some vacuum is there.
Yeah. Or no, at times out of guilt also they do. So no, if we then even no, here counselor can help.
Right.
No, in understanding no, where is the cause.
Right.
And if they deal with the cause with various techniques, then no, even without medical help one can get rid of it. Or if necessary, no, those medicines also can be taken for OCD part.
I think, doctor, it is very, very important, like we are saying, it is very important to let go of the negativity, let go of the addiction, and at the same time develop the positive qualities also.
True.
So how do we do both simultaneously?
So once understanding, and then no, what are those qualities which will help me?
Right.
No, like if I feel more happy, I will not be addicted.
So
If I have a
experience
self-esteem, I will not drink alcohol. So no, work on those aspects. Even there are good medicines even. For smoking, clonidine, it's actually anti-hypertensive, but that indeed helps in reducing the urge. So it can definitely be tried. No, those who nowadays, those nicotine patches are also there, nicotine chewing gums, but some says it's not working.
Correct.
But no, clonidine also can be tried in a small amount with no medical supervision, and it can indeed reduce the urge. There are other medicines also which can help in reducing the urge, and for even alcohol there are very good medicines.
Right. So there's
There
no
are
harm
even-
in taking medicines.
Oh yeah, harmless, but only no with medical supervision.
Correct. With medical
Yeah.
supervision.
One thing no, for alcohol, the withdrawal which is causing problem, there can be medicines.
Right.
There are medicines to reduce the urge also.
Right.
Even there is actual substitute.
Okay.
Yeah, it does wonders sometimes. Only thing, no, they should have a bit of the desire.
That realization has to come.
If it-
I think it is a very, very important topic what we've taken up today, that the first step for a person who wants to bring about a change is to accept that there is a problem. And then reach out for help.
Well, true.
And then help is available. Like you're telling us, medicines are available, good doctors are available, and it's not really difficult to make that switch.
No, true. They have to work on themselves.
They have to
Even
work on
meditation
themselves.
can be a good way.
Correct. So I think we are going to take a break here
True.
today, because again we're looking at the time constraint,
True.
but very important, and I'm sure the viewers must have really benefited
Right.
from this, because
True.
a lot of people are having this, it's become like a struggle. So they can definitely get in touch with you, and
Or maybe some other doctor also. No?
even some other doctor who their friends
Different.
recommend
True,
or
true,
patients
true.
recommend,
Yeah,
they can get in touch and get some help. Thank you
True,
so
true.
much, doctor, for being here. Thank you. Om Shanti.
Yeah, Om Shanti.
I would urge our viewers that if there is a problem, we must ask for help. Just keeping the problem to yourself and struggling with it, I don't know how that's going to help. If you're feeling hurt inside, if you're struggling inside, you're feeling that pain, please come out with it. We are here to help you. Addiction is not just drugs. It could be any addiction that you want to get out of, and help is available. So let's get closer to our fitness formula by helping ourselves. Let's take charge of our lives. We'll meet you very soon. Till then, thank you. Om Shanti.
Meditation and nutrition, soul power and your vision, pure intention, attitude gives you mission and a mission. Small step